Hi, welcome to Wild Child Wellness, where we discuss natural remedies for common childhood symptoms and when to seek medical attention. I'm Julie DeVono. I have 30 years experience in pediatric nursing, as well as homeopathy and natural remedies. So the purpose of this video is informational only. It's not a substitute for medical advice from a trusted medical provider. So you're going to want to get yourself one of those. And today's topic is very common issue with children that parents have to deal with, and that's tummy troubles. So we're going to cover things like gas and colic in babies, up to constipation, vomiting from a stomach bug, even long-term conditions like recurrent abdominal pain or RAP or abdominal migraines. So it's a lot to cover, and it covers a lot of different ages. So bear with me on that. And let's just jump to it. Now, one of the things you might notice that's different today is I'm going to try to record one of these videos without wearing my glasses, because I've noticed that I can't figure out a way to get around having glare from the glasses reflected in the video. So I'm going to use my iPad today for my notes, and I have it with really large print. So hopefully we'll be able to get through it and the video won't have the glare and it won't look so funny. So let's jump into tummy troubles, and let's start with some of the first tummy troubles that you'll deal with as a parent, and that's colicky babies or gassy babies. Either way, they're miserable babies. So we're going to talk about some natural remedies to help alleviate that, and go over, as always, some red flag symptoms that clue you in that, okay, you've done enough and you need to seek medical attention. Now, gas or colic, very common problem with babies, sometimes starting from day one. And I am going back and forth between the two terms because sometimes it's hard to tell. Are they colicky because they're gassy, or are they gassy because they're colicky? There is actually a technical definition for true colic, and it's one of those things that we don't quite know what causes it. But when it's true colic, that's when a baby will cry for an unknown reason relentlessly for 20 hours a day or more, and for some reason it just magically subsides at 3 months of age. A lot of people have theories that it could possibly be related to silent reflux, which is like the baby's having heartburn because they have reflux. I'm going to go over some tips on how you can try to tease out the difference, because they would be treated a little differently. And a lot of colic may be just gassiness, so I'm going to touch on that too. So, colic usually resolves at 3 months of age. Again, we don't quite know why. It may be because that's when a lot of babies are introduced to solid food, or it may be that at 3 months of age, the pyloric muscle, which is the muscle in the stomach that is supposed to tighten up to keep the stomach contents in the stomach so that they don't splash back up and hit the esophagus and cause heartburn. When babies are first born, everything, their muscles, everything is loose and leaky, and they're on a liquid diet. So if you have a weak, underdeveloped pylorus muscle, you're going to be more prone to heartburn, especially positionally. Like if you just fed your baby, and of course it's a liquid diet, it's either formula or breast milk, and that muscle on the top of their stomach is supposed to close nice and tight so that when they lay down, it doesn't leak back. Well, if their muscle is not quite fully mature yet, that leaking can happen and then hits the esophagus and then causes heartburn or spitting up. So that may be part of why colic seems to mysteriously resolve at 3 months of age, but we're not 100% sure yet. And that's the takeaway with colic. There is still a lot of mystery around it, and mainstream medicine, we're still not quite sure what causes all of it, and that makes it difficult to fix it. So sometimes it's gas, sometimes it could be reflux, sometimes it could be we don't know, your baby just has colic, and if you can ride it out for 3 months, it will get better. It becomes a vicious cycle, and that's because something causes the baby to start crying. Often that is an episode of gas. So they have the gas, that's uncomfortable, and that makes them cry. But crying itself causes them to swallow a lot of air, and then swallowing the air makes them more gassy, which makes them more uncomfortable, which makes them cry more. So it really can become a vicious cycle where they're just spiraling up, and it can be very frustrating. Now, you can rule out an emergency situation if, despite the incessant crying, your child is still feeding at their normal schedule. With some babies, that might be every 2 hours. With some babies, that might be every 4 hours. But if your baby is still taking a feeding at their normal interval, then it's not an emergency, despite the fact that it may feel like one because of the incessant just please do whatever it takes to make this crying stop. And also that there's no fever, there's no vomiting, and they're having their bowel movements with normal expected regularity, with their normal consistency. So if you've ruled out all those other things, you can try changing your diaper, the baby's diaper, you can try holding them, you can try burping them. But if you've ruled out everything else, then there really isn't any signs that it could be a medical emergency. In fact, it really looks like more of an emergency if a baby stops crying and is more listless, but those are caused by other things. That's what you're going to look at. And of course, I often get the question, well, how often should they be pooping? Well, every baby's different. Some babies, especially if they're breastfed, only poop once a week, or they might poop every 2 to 3 hours. It's what you've already established is normal for your baby. Now, with colic, you're not going to see a change no matter what their position is. I'll often say with colic, they're crying whether they're sitting up, laying down, held upright, hanging upside down, it doesn't matter. They're just still crying. Where with reflux, you should see an improvement with their position. So what that means is it's worse when they're lying flat, but if you hold them upright, they seem to have some relief. So if you see a difference in the severity of this crying or the symptoms based on their position, then that might be a key that it could be reflux that's causing the colic. And if they seem really gassy and you relieve the gas, then with either a heating pad on their stomach or a warm towel, or what I would often do is I would recommend having the baby on their belly with their knees under them, kind of with their butt up in the air, and put a heating pad or a heated towel under them, so they're lying on their belly with their belly against the heating pad and their bottom is up in the air. That's a great way to help try to relieve the cramping with the heat and relieve the gas. So that's just a tip that can try to help with that. Now, if you're breastfeeding your baby and your baby does seem to be excessively gassy and colicky, one of the first steps you can think about is there's something called foremilk and hind milk. Foremilk is the breast milk that the baby gets for the first 5 or 10 minutes, and it's for hydration. So it's very watery. It's sort of like a natural Gatorade if you think about it, because Mother Nature's priority is to hydrate before giving food or feeding. So you want to hydrate before feeding. That's just part of how it works so that the feeding is absorbed better. And then after about 5 or 10 minutes, the breast milk changes to that thick, heavy, dense breast milk. And that's the more nutrient-dense breast milk. Well, some women will have too much foremilk and not enough hind milk. And if that's the case, you're going to have colicky baby. They're not only going to be gassy, but they're going to be very colicky and fussy because they're not getting enough of that dense milk. So it's like they're hungry all the time. And they're feeding every 2 hours, every hour and a half to 2 hours, they seem hungry. They seem like they have a lot of gut distress. And if that's the case, you can try something called block feeding. Block feeding is where instead of alternating, which all breastfeeding moms have probably been told, you nurse on one side and then you nurse the next feeding on the next side, and you start on the left side and then the next feeding you start on the right side. Well, if you have too much foremilk, then just as the baby's starting to get the hind milk, they're full, their belly's full, but then they burn through it too quickly, and then at the next feeding, they're just getting more of the foremilk. So block feeding is where you do the same side for 2 feedings in a row. So you're going to start on the left side, and then at the next feeding, you're going to start on the left side again, hoping that the baby will get less fore milk that time and more hind milk. And then for the third feeding, you do the right side, and for the fourth feeding, you do the right side. So instead of alternating with each feeding, you're doing 2 sides in a row and then switching to the other side. A lot of moms have found that helpful. So that's something you can consider trying. Another thing is more with the reflux or heartburn side of things. And, that would be if there's a food that the mom is consuming that the baby may be sensitive to. So you may want to do what's called an elimination diet. And that's just fancy medical speak for eliminating one food at a time for a couple of days and seeing if that helps. For example, the most common culprit is dairy. Cow's milk proteins are very large proteins, and they're very hard for babies to digest. So by removing the cow's milk protein from the mom's diet, the baby won't get those cow's milk proteins until they're a little older and their gut and their digestion is more mature, and then they can handle them. So just because your baby doesn't tolerate cow's milk when they're newborns or when they're little, doesn't mean that they can't have dairy products later in life. It's just that their gut isn't mature enough yet. So a lot of moms will try eliminating dairy. And then after about a week, if you don't see a difference, then you can bring the dairy back, because it definitely wasn't that. And you could then try eliminating eggs. Eggs are the second most common culprit. And then when you get to the third most common culprits, it could be gluten, it could be nuts, it could be peanuts, it could be a mix of that. So you want to keep an eye on that. I even had a mom once that made it through quite a list, and then we found out that it was vitamin C. She was consuming a lot of fruit and a lot of fruit juices, and she was also taking a vitamin C supplement, and that was just too much vitamin C for her baby's gut to tolerate. Once she eliminated the excessive amount of vitamin C through cutting down on the fruit, she was snacking on these little dried fruit leathers. Once she cut that out, the baby seemed fine. So these are all things to think about. So trying the block feeding first, trying the elimination diet first. If you're formula feeding, then that's when you might want to consider trying a low lactose formula, or even a cow's milk free formula, or they have some formulas that are pre-digested, so they have added enzymes to break down those milk proteins so they're easier to digest. The trick you want to be careful of, though, is you don't want to do, when you're trying to find the right formula, you don't want to switch formulas too quickly, because anytime you change a formula, it's going to take time for the baby to adjust to it. And I would often see parents that, in 1 week they've tried 3 different formulas and they were just at their wits' end. So we would have to start again, and I would recommend, wait a good 4 days before you try switching another formula. I understand the urgency, because that could be a really miserable 4 days, but that's really the best way to go about doing that. So for colic, think about that. And I talked about, like, with the signs of reflux, position. If you do really suspect reflux, then gravity can be your friend. So you want to keep your baby upright as much as possible. You may want to get a wedge for sleeping so that they're not sleeping completely flat, but they're more at a level. You want to hold them upright for a good 20 or 30 minutes after you feed them. In the olden days, we used to just have the babies in their car seat all the time, but nowadays they've created products that are baby positioners that might be more helpful, or just holding the baby in a carrier. But gravity is keeping that liquid formula or breast milk in the baby's belly and avoiding that splashing up and causing that heartburn. It doesn't mean that your baby's going to have reflux forever. At the 3-month mark, usually that pylorus muscle has fully developed and gotten bigger and stronger, and the stomach is, the muscles holding everything tighter, so the problem self-resolves. So you don't have to worry about that anymore. So they tend to outgrow it at about that age. Another clue to reflux is you may find that your baby is a very aggressive feeder, and that's because they're spitting up half of what they're eating. So they're hungry an hour and a half later or 2 hours later, and when you go to feed them, they're just like so hungry, they're gulping, 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 and then they reflux more because they've eaten too much too fast. And if you're breastfeeding your baby and they seem to be doing that, then you can try what's called paced feeding. Paced feeding means that you breastfeed for 10 minutes and then you make your baby take a break of a couple of minutes. And then you nurse them for another 10 minutes and then you make them take a break for a couple of minutes. It's frustrating because the baby's going to cry because they don't want to take a break. But as parents, we know we have to provide what our babies need, not what they want. Sometimes what they need is to take a break, even if they don't want to. And that's kind of a lesson that carries through with a lot of things with parenting. If you're formula feeding, then again, it's the same type of thing. You may want to, give them 2 ounces and then make them stop and take a little break and then give them another 2 ounces. It's very common advice to give parents that are bottle feeding to thicken the formula. The reasoning behind that recommendation is, well, if the formula is less liquidy, less watery, it won't be so prone to splash up. It'll be heavier, so it'll sit in the stomach better. So you might get advice about thickening the formula with added things like organic oatmeal baby powder cereal, or they used to recommend rice cereal, but rice cereal has kind of fallen out of favor with different problems we found with a lot of baby rice cereals having arsenic. So you want to look into that. But I just shifted my recommendation away from rice to oatmeal. So you can talk to your medical provider about that. But you do have to understand, in life, there's no solutions, only trade-offs. And the trade-off with that is your baby will have less reflux and less heartburn and less colic spells. But by putting this heavier formula cereal mix in their belly, you could end up with constipation issues. And then they're unhappy about that. So, you have to be wary of trying something, but knowing, okay, this could maybe lead to a different problem. And in the end, we might be just choosing the lesser of 2 evils. So keep that in mind. So, now let's talk about some of the things you can do to relieve it. Well, there's a lot of different natural remedies to relieve colic. Some of them you might have already heard of or become familiar with. I don't have personal examples in my home to show you, so I'll just pop up some pictures. And that's because my baby is now 15 years old, so we don't need these things as often anymore. But one of the most common remedies recommended is gripe water. Gripe water is not a brand, and that's because gripe water is an old-fashioned remedy that goes back hundreds of years. Mothers have been making or buying or using some form of gripe water for centuries. And there's recipes that go back, and they all seem to be the similar combination. And they usually include a combination of herbs like ginger, fennel, peppermint, chamomile, dill. You'll find different combinations of those things, but it's usually a couple of those different ingredients in a combination. And there are brands that you can buy that are gripe water, but they're usually like a different brand. Like one is like Mama's Bliss or Highlands. There's hundreds of them, but they're all some different formulation of gripe water. So it's some formulation of those different herbs, and they're little liquid drops. Now the thing about gripe water is it is perfectly safe to give as early as even the newborn age. There's not a lot you can give a baby under 3 months of age, but gripe water is one of those things that's safe for that age. So if you've got your baby home and your baby's only a week or 2 old, but they seem to be really colicky, the gripe water can help with that. And that's because those herbs are usually a combination of an herb that's anti-gas and an herb that is anti-cramping. And they're very small amounts in the liquid, and it's perfectly safe. So I often recommend that right out of the gate at the newborn well. Say, make sure you have some gripe water in the house because you might need it, and it's fine. There's another remedy called Colic. It's the same combination, but it's in just a different formulation, different brand, and and that's because these herbs all have different helpful uses. For example, chamomile, fennel, peppermint, those herbs are called antispasmodics. So they relax the stomach muscles that cause the cramps. So that's why it would help with colics, because it helps relieve the cramping. The ginger is often an ingredient because that is an anti-gas remedy. Ginger, probably because the heat that it creates, ginger is a hot herb, so it creates a heat sensation. And that heat sensation, the way that it may work is that, this is my own personal theory, is that the heat sensation causes the gas bubbles in the stomach and the intestines to dissolve. So that's how that works. And then of course, like I mentioned before, just the heating pad, or sometimes I would throw a small towel in the dryer, get it nice and warm, put it down, lay my baby down on his belly with his butt up in the air, and that could usually break the cycle, relieving the cramping and making him more comfortable. And then often he would even fall asleep, and that's you get a break. You get a break from the crying for a little bit. There are some mainstream medications too that are recommended and safe for gassiness or colic. And the most common one is a medication called simethicone. Simethicone is more widely known by its brand names. It's the ingredient that you'll find in something like Gas-X or Mylicon. It used to be very common at the pharmacy. You would find Mylicon drops. Now most of the pharmacies carry this medication as just infant gas drops by different brands. So you might have a branded medication and it's like, okay, infant gas drops. It's all simethicone, and simethicone is a medication that is kind of like it's an anti-surfactant. So what it does is it breaks up the bubbles, and it's impossible to overdose on it. We know that because my son has tried. When he was a baby, he got into a box of extra strength Gas-X and nibbled a couple of the capsules, and of course we had to call poison control, and that's where I learned it's just simethicone. He can't overdose on it, but maybe look over your medications and try to do a little bit of a better job child-proofing your home, which is good advice. But when you're a mom, especially of a boy, you know that child-proofing is always an ongoing goal and process. It's never something you often achieve completely. They always seem to be one step ahead of you. But, but it was a good way for me to learn that simethicone, as much as I like to avoid mainstream medications, that one in particular, you're not going to overdose on it. It doesn't make them sleepy. So it's safe to try if you want to. If you've tried the natural stuff first and you want to try something mainstream. Now, so when should you seek medical attention? So if you have a colicky baby, the red flags you want to look for is weight gain. If your baby is not gaining weight appropriately when they go for their checkups, if they seem to be gaining weight slowly, or even if they're not gaining weight at all, or even losing weight, then that's a big red flag that you need to seek medical attention. Because if that's probably the single biggest sign for if a baby's doing well is if they're gaining weight. There could be a lot else going on, but if that baby's gaining weight, you're usually not dealing with something super horrible and terrible. But that means that even if nothing else seems to be going on, but a baby's not gaining weight well, it's a big red flag and you got to get to the bottom of it. So now, as far as for reflux, there is a homeopathic remedy that's got a very good reputation. It's been used widely for many, many, many years to treat reflux in babies and adults, and it's called Nat Phos. Nat Phos is it's a homeopathic remedy. It's these little pills. You can dissolve them and give them to your baby. Now, with homeopathic remedies, they come in different strengths. The one that you would want to look for is 6X. So if you want to find yourself some Nat Phos 6X, give it a try for a week or two. It has a very good reputation for being very effective for treating heartburn, which is what's leading to the reflux in babies. And what's good about it is it's homeopathic, so it's very safe for even very young babies. So you can look into that. Chiropractic adjustments are also extremely effective at relieving digestive issues in babies and can work very well at treating or improving reflux symptoms as well as constipation symptoms. So if you're dealing with, a baby that's colicky or a baby that seems to have reflux or constipation, a trip to your local pediatric chiropractor can really do a lot to help relieve those symptoms. So it's definitely worth looking into. And then, of course, even if it's reflux, those other things that I mentioned for colic, like the chamomile and the ginger and the fennel, the peppermint, you can give those a try as well. You'll just know that, okay, those can also provide relief, but you'll at least have a better handle on the cause of your baby's colic, that you'll know it's heartburn and reflux, unlike other parents that you rule that out and you have nothing else to give them as far as the cause for their colic. Their baby's just colicky. So take that for what it's worth. Now we're going to shift gears and talk about constipation. Now you usually don't deal with constipation in babies until they get to the age when you're introducing solids. Although you can have some constipation issues if you're transitioning a baby from breast milk to formula. And that's because the breast milk is easier to digest, so they're less likely to get backed up. It almost has like a laxative effect, where the formula is a little bit harder to digest, so they can end up getting, it's just a very common story that you hear, that when a baby transitions from breast milk to formula, they may go through a temporary bout with constipation as their gut adjusts to the new food, the formula. Now, for some moms, I'll recommend that if they're kind of doing both, like a lot of moms will do breast milk and formula, they'll go back and forth. So if your baby's getting constipated, you can mix breast milk and formula together. So if you're finding that when your baby's getting breast milk, they're fine, but when they get a bottle of formula, they get backed up and they get constipated, then I'll recommend, well, why don't you mix the breast milk and the formula together, give kind of a bottle of like half breast milk, half formula, and that can help. The laxative effects of the breast milk can help prevent or treat the constipation issue. Just remember, some babies it's normal for them to poop every day, and some babies it's normal for them to only poop once a week. So you can't judge constipation on the frequency of the poop. It's part of the diagnosis, but it's really more about what's normal for your baby. So if your baby has only ever pooped twice a week, we're not going to call it constipation because they haven't pooped for 2 days. It's part of the story, but it's not the only thing we're going to say, oh, well, your baby hasn't pooped for 4 days, so they must be constipated. I would have a lot of new parents with new babies, and they're colicky babies, and they'd say, well, I think the baby's colicky because they're constipated because they only poop once a week, and my mother-in-law or my aunt told me that they should be pooping every other day. No, that's not true. So we don't go by just how long it's been since they poop. If the baby's otherwise perfectly happy, they can only poop once a week. That's fine with me, as long as they're happy. But if you've got a baby that's showing other signs of distress, then it might be important to consider. Now, another thing that I want to talk about is, very often new parents will confuse normal baby grunting with constipation. So they'll call me and say, I think my baby's constipated because they're a little colicky. And when they do poop, they do a lot of grunting and they do a lot of pushing and they really look like they're struggling and their face is all red. So they must be constipated. And I'll say, well, but are they pooping every other day? And they're like, oh yeah, they'll poop finally and then they'll be fine. Okay, so that's not a constipation issue. That's normal baby grunting. Some people call it grunting baby syndrome, although I hate calling it that because it kind of infers some kind of problem. But it's normal for a baby to go through a bout of grunting and pushing and being red-faced before they finally poop. And then if they do poop and the poop is liquidy or squishy, then they're not constipated. It's just that babies' guts are weak and underdeveloped. So they have to get those muscles stronger. So when you're seeing the grunting and the struggling, it's sort of like if you imagine that you decide to start going to a gym and start lifting weights. Well, the first couple of times you're lifting those weights, you might be really struggling and grunting and your face might get red. But with practice, as your muscles get stronger, you will struggle less. And it's the same thing with the baby. In the beginning, they're struggling and grunting with the pooping because they're exercising those gut muscles that are a little weak and underdeveloped. But with time, as their gut muscles get stronger and more developed, they'll struggle less. The reason I'm saying that is because I've seen too many parents see that grunting and struggling, and they jump too quickly to assuming it's constipation, and then they treat it like it's constipation. Very commonly, the treatment will be a rectal stimulation with a thermometer, and then they'll poop. Well, the problem with that is what you're doing is you're kind of helping them, but you're preventing the muscle strengthening that they need for the long term. So if you're doing that every time they seem to grunt and struggle, they're never going to get the opportunity to build those gut muscles stronger and then not need you to do it. So it becomes sort of like a vicious cycle. So you really want to hold off on doing that unless it's been a good 4 or 5 days and you can really tell that the baby's struggling and getting worse. But doing it every time they grunt and struggle, it's like if you're trying to lift weights to get stronger, but every time you struggle, somebody takes the weights away from you. No, you need to kind of work through that to get stronger. Your baby needs some time to work through it to get stronger as well. So, keep that in mind. If your baby is having what I call rabbit poops, which are these tiny little round poops and look like what rabbit poop looks like, that's a sign that they need more water. And if your baby is 6 months of age or older, you can give them a couple extra ounces of water, either in their bottle or in a sippy cup, and that can relieve the problem. If your baby's younger than 6 months of age, talk to your medical provider and they'll let you know how much water you can give your baby, because when they're younger than 6 months, you don't want to give them too much free water because that could stress out their kidneys too much, and that's not good. So if they're over 6 months of age and you've been starting to give them solid food and you've noticed these little rabbit poops, that means they need more extra water. They're younger than 6 months of age, talk to your medical provider about it. And they might say, yeah, get maybe 1 extra ounce a day, or they might give you some kind of amount, but it's actually a formula based on their weight and how they've been growing. So you don't want to just take that information. You don't want to do that on your own. You want to talk to a medical provider to get the help, to get the right amount, if any at all. So now talking about the treatments for constipation. Chiropractic adjustments, I touched on that already. And I'm going to do a little bit of shameless promotion here. On my Etsy shop and Shopify, I have an herbal tea called Poop Tea, pretty self-explanatory. And it's a combination of herbs that will help with colic, gas, and constipation. So I just want to touch on the ingredients in that. So the ingredients in it is, of course, senna. Senna is probably the most widely recognized and well-known herbal remedy for constipation. So it's a natural herbal laxative. So the dried senna leaves are an ingredient, or powdered senna leaves. If you go into any natural remedy store and you look for natural remedies for constipation, you're going to find they all tend to have senna in them. And even something as commonly known as Senokot, well, there's a reason it's called Senokot, because it's got senna in it. So senna is an ingredient in this tea that is a laxative. And then there's also slippery elm. Slippery elm is an herb that is called it's going to be kind of hard to pronounce. It's mucilgic. So what that means is it helps your body take fluid and turn that fluid into a mucus. That's why slippery elm is a very common ingredient in a lot of cough remedies. It's a really great expectorant, because if you're dealing with a cold and you have a cough and a lot of chest congestion, the slippery elm will take the fluid and turn it into a mucus, so it's easier to cough up. It can also then be used, and is very commonly used for constipation, as a stool softener. So it takes the liquid from the intestines and turns it into a mucus, and then that mucus makes the poop softer, so it's easier for your baby to pass it. So that's why I put slippery elm in the tea as an ingredient. And then it's also a very common ingredient in a sore throat remedy too, because the slippery elm takes the fluid and turns it into a mucus that coats your throat, so it soothes the sore throat as well. So it's a great herb. And you've heard me say before, I'd rather have one remedy that I can use 3 different ways, then 3 different remedies that all do the same thing. So it's a great multitasking herb to have on hand. And then of course chamomile for cramping, because chamomile is a great anti-spasmodic. It relieves the cramps that comes with constipation. So it makes your baby a little more comfortable, so they're less crampy while they're constipated, while they're working it out. So that's why I have the ingredients in that. So now let's shift to a different tummy trouble, and that's diarrhea.